referrals have increased. And like I said before, I think the complexity has been borne out because of the fact that problems or challenges that might have been there in March, April, that could have been dealt with in an early help offer or a single assessment and a child in need plan. Now we're seeing them coming through in September, October, and in often these cases the situation's got a lot more challenging. I mean, we've got people who are now, families who are losing jobs, families have lost money, families have lost loved ones as well, and all those pressures are being brought to bear on children within family settings. And as John rightly said, the support networks that we would normally reach out to, the domestic violence helplines or the communities resource or the family centres, they've been struggling. So the support that we would put into families at an early point to try and alleviate some of these pressures haven't been as responsive, haven't been there they've been struggling as well. So it is more complicated, it is more challenging, and we need to work together with our colleagues, our multi-agency colleagues, to make sure that with the new lockdown coming, that we keep the focus on children and their families and make sure that children remain central to our decision making. Yeah.
And I was going to say there's two things. One, something Steve touched upon. I think there is a positive to come out of this. As you alluded to, it forced people to stop doing the day-to-day things that they've always done and never questioned, and it changed the medium in which they deliver it. So technology, as you allude to, Martin, but things like new remote ways that are actually probably more 21st century and more in keeping with probably younger people. Those technologies started to be used, and I think that's great, and it's a real opportunity moving forwards. I think the problem that we've got is that not everyone is necessarily technologically savvy, and if we're continuing that, we have to be conscious that actually that has a resource requirement on staff, to actually embed something like that. That's in the context of what we're describing, which is a day job, which is probably 200% of what you had to do previously. So finding that time is incredibly complex, and I do think there's an opportunity there, but it always boils down to the right, the time. And I think a second point, just picking up on what Martin just said, is that understandably, the children's social care is about assessment of risk, and given the complexity and the demand, the focus is going to be on those individuals who are at most risk because of the resource. But what we've got bubbling underneath this potentially then is the next wave of complexity, because we're focusing on, it's like firefighting, isn't it? It's triage. Who's the most urgent? We'll focus on that. And then the next wave are coming along because we haven't got the resource necessarily to help support them. And I think that's a real challenge. We're looking sort of 6-12 months in the future. We can almost tell who's going to be the next cohort of people because of that underlying bubbling risk.
Yeah, I think you're right. To carry on the metaphor, is that the first wave is that you see that front wall of water, but actually the pressure is coming from all the way behind it. One point that John raises there is very, very interesting as well, is that we mustn't replace the old with the new without taking the good things of the old. Yeah. Is that when you talk about people in the technological prowess, is that why would you want to take someone who's really, really good in face-to-face situations and stop them from being into face-to-face situations entirely by saying, you can throw the baby out with the bathwater and say, right, we're not doing it that way anymore. That's old. That's rubbish. It's all pathetic. And then take forward to the new situation. It is different ways of working, and have the ability to pull on those and using the right solution for the right situation, which is absolutely key in any kind of thing. To be very prescriptive on how you're going to deliver your services stops that flexibility and that agility that is needed to deliver the best of outcomes for the best for all. I think as well is that there's also the issue now in terms of the workforce is that might not have been spotted over the summer. But I remember right at the very start of this is that people were self-isolating an awful lot. And then that seemed to go out of vogue. Now, is that because of the number of cases, started to flatten out? We're going to find that members of the workforce are going to be more directly impacted by COVID as cases and deaths rise again from their own personal situations in terms of people they know, themselves, their family, or whatever, in a way that they've not been over the last 4 months. And we had a situation where, when the pandemic hit, morale actually, from my feelings across the region, actually in many ways went up. There was a common sense of purpose, a common sense of being, that you were, that it was all hands to the pump. And in many ways, is that there was a concern within a number of local government departments that actually people weren't taking annual leave at all. And they were becoming exhausted and they were becoming tired. And we might have, and that again might be a problem that's being, stored up in a way that now that people are coming into the second wave, actually possibly in a worse situation than the first, because they haven't got the energy or the resilience or the internal resource of will, because that is a finite resource and everything else. So how do you support people through what is, again, something that hasn't got a definitive end?
That's really, really important, Steve. Children, which you're absolutely right, that's the focus. But what we've got to be conscious of is to support them to achieve the outcomes, to get them safe. That is only going to be achieved by the people that an organization employs. So the service is only as good as the people, and the people are only as good as the support that's put in place. And the toll, I heard a great phrase, someone said, inherently social workers are people. That's what they, they enter into that profession. So we can't underestimate the impact of, whilst, some calls like this are great, we can't underestimate the fact that, people who enter that profession enter it for a reason, in terms of building engagement and rapport with individuals. So there's a big psychological toll as well as the stress. So we've got to tackle this issue of this surge in demand, but we've got to be conscious that that's only going to be tackled by a workforce where their well-being is front and center, because the service to those vulnerable children is going to be as good as the position that they're in and how they feel.
And I think you're right, and risk of moving the discussion on before we've covered everything there. I think that the ability to bring in extra resource and how that's going to be done, I think is absolutely key. Is a Rick consultant, we've been undertaking some work in terms of what are your usual measures to provide additional capacity or additional support or cover gaps. And I don't want to prejudice people who are still filling it in. I'm not going to do that, but everyone traditionally will look to go to an agency staffing route, and that in itself, there's no issue with it. It maintains your service. It fits in with your present structures. Everyone sort of knows where they are and what's expected of them. But if everyone goes to that well at the same time, there may not be the resource that you need, or it might not be effective, and it might not be readily accessible if you have a crisis situation. So I think that there needs to be, rather than say, well, we'll always be able to go there, actually, is that the best way of going about and supporting services? I know for a fact that in the West Midlands, where I've conducted most of my work over the last few years, one thing that we noticed was that we suffered with our MOU, or MOC as it is in some areas, around capping agency staff rates, because people will put up with things for a certain length of time, your perm staff and any contingent labour that you've got. It is an ongoing issue where things do not seem to get any better, or there is no endpoint in sight. That is when the toll on people's resilience starts to take effect.
Yeah.
I think as well as a significant point as well in terms of the actual benefit of doing something for a social work team who is getting completely battered is a massive impact on a potential retention strategy. Actually, look, our senior leaders realise that we're in difficulty here, and they're providing a solution, that allows us to undertake work in a way that we want to do it. Yeah. Now, and again, I think that no matter what your solution is that getting those messages to your staff is where you really add value. because that helps you with matters such as retention, which is massive. If they don't like the solution, a little bit of understanding as to why it is there, and actually we're doing this for you, and with you in mind as a different. And I think that bringing in expertise around that and managing that can really, really help. As John was going back and he kept mentioning the employees, it is the impact on your own employees, which is significant.